Welcome to part 2 of our series on Blenderized Tube Feedings, presented by the Council for Pediatric Nutrition Professionals. Last month's Nutrition Pearl provided an introduction to Blenderized Tube Feedings. This month, we'll dive deeper into creating a recipe and monitoring a patient after implementation. www.choosemyplate.gov has excellent guidelines for portion sizes and calorie goals for each age group. Today, I've selected a meal plan for a toddler with a 1,000 calorie requirement as an example. Notice that each food group gives suggested portion sizes as well as tips for selecting foods. Next, I'll write in some foods that fulfill the guidelines of each food group. Notice that an estimated calorie count is slightly low on our calorie goal. For a quick and easy way to add extra calories, assuming other nutrient needs are met, I can add in healthy fats. In this case, half of an avocado and 1 teaspoon of olive oil brings the calorie goal to 1,005 calories per day. As clinicians, we tell our orally fed patients that variety is important in the diet, and this is just as essential for our patients receiving Blenderized Tube Feedings. First, encourage families to vary the types of foods they blend every day so that ideally the patient will obtain all of their nutrient needs when we look at his or her intake over several days. Next, there are some substances present in our food system that we don't desire. For example, tuna is a great food for blends, but daily tuna intake is concerning for excessive mercury content. So, trading out the tuna sometimes can be ideal. Lastly, variety reduces the risk for nutrient overload or toxicity. With any new tube feeding regimen, follow-up assessment is essential. We can monitor growth and adjust the calories, add more water to improve hydration, and treat constipation by altering the fiber content. If volume tolerance is a problem, we can reduce the volume of blends by substituting nutrient-dense foods for water-containing foods. Many patients who start a blenderized tube feeding have never had real food before and require monitoring for allergies and intolerance. And lastly, as much as we try to make the blends nutritionally complete, some vitamins that are difficult to incorporate through food, like vitamin D, often need to be monitored and then supplemented separately. Thank you.